Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. First of all, I would like to introduce myself. My name is Aprilia Wahyu Kusumastuti. I'm a college student from Medical Laboratory Technology Polkesyo Yogyakarta. In this occasion, I would like to explain about my poster. The title is Let's Care and Recognize Diabetes. First, we should know what is diabetes. As we know, diabetes disease is a condition we often find in everyday life. It is a medical condition that in which body can produce enough insulin to control amount of sugar in the blood. Insulin is a hormone that regulates the blood sugar. Diabetes was caused by many factors like level of blood sugar is high, obesity from food or beverage that contain a lot of sugar that often we consume, and many more. If the diabetes disease is not controlled as well, it can be cause a serious consequence, cause organ damage such as heart, kidneys, eye, and nerves. Diabetes disease itself has divided into two types. There are diabetes type 1 and diabetes type 2. Diabetes type 1. This type is an autoimmune disease, meaning the body's immunes will attack itself. Diabetes type 1 was caused by genetic factor and the body can produce insulin at all. Diabetes type 2. This type is the body can produce enough of insulin and the body of diabetes sufferer will not respond normally to the insulin. Diabetes type 2 was caused by genetic factor and lifestyle. In general, people in the world with diabetes type 1 are about 10%, and meanwhile, people with diabetes type 2 are about 90%. And talk about diabetes statistic. According to IDF, International Diabetes Federation, in 2021, 19.47 million of people in Indonesia suffer of diabetes. Meanwhile, the prediction of IDF in 2045, amount of diabetes sufferer will reach 28.57 million. It means there are decrease of people who suffer a diabetes. Even according to WHO, diabetes is the 8th deadliest disease. Then talk about the symptoms. What about the symptoms? The symptoms are 1. Feel always thirsty. 2. Frequent urination, especially at night. 3. Feel so hungry. 4. Lost weight without clear reason. 5. Limp. 6. Wounds that are hard to heal. And point number 6. The diabetes sufferer must be careful because it can be infection. 7. Blurred vision. 8. Dry mouth. 9. Diabetes sufferer often have infection. 10. Feel burn and pain in the leg. 11. Itchy. 12. and decrease of muscle mass. Therefore, there is need for awareness about this diabetes disease. Below, I will mention some ways to prevent diabetes. 1. Apply the healthy diet. It means that people eat healthy food 3 until 5 serving of fruit and vegetable in a day. People also eat more fiber food such as orange, papaya, apple, fish, whole wheat, also vegetable such as broccoli, spinach, mustard green, and cabbage. Make it habit to always drink mineral water every day. 2. Do physical exercise regularly. Start the physical exercise with small activities like walk for 20 minutes in the morning. Besides that, you can do physical exercise by ride bicycle, swimming, yoga, or gymnastics. 3. Manage stress. Always manage your mood and stress because it's very influential on health, especially in blood sugar level in the body. To manage stress, people can do meditation, yoga, keep with physical exercise, have a good rest, always think with positive vibes, calm the mind and hobby, or something that makes our feels happy. 4. Always check blood sugar regularly. People can check the level of blood sugar with a few tests like a HbA1c, insulin C-peptide, postprandial blood glucose test, and many more. Checking blood sugar of developing diabetes regularly also help people to maintain a healthy lifestyle. Besides that, it also avoids the risk of developing diabetes. Checking blood sugar right now is also quite easy. We don't need to come to hospital, but having a sugar checker, we can do it ourselves. 5. Maintain ideal body weight. We should keep our weight by not forgetting healthy habits, keep the diet, and increase the physical exercise intensity. Next, I will talk about treatment for people with diabetes type 1 and type 2. The treatments that should be followed are: first, for diabetes type 1, use insulin if the sugar level is too high. It can be lowered by using insulin because sugar level are 70 until 120 milligrams. Doctor will inject insulin several times a day. Giving is done by injection because insulin will be digested by the stomach and cannot enter the bloodstream when given in pill form. The treatment with insulin must be accompanied by regular checks of blood sugar level to ensure blood sugar is always within normal limits. This is because blood sugar level can be affected by various things such as exercise, medication, non-hormonal change, and general health condition. In addition to insulin, doctor might prescribe the following type of medicine. 1. Aspirin to maintain the patient heart health. 2. Angiotensin converting enzyme inhibitors or ACE inhibitors and angiotensin II receptor blockers or ARBs to maintain the patient kidney health. 3. Cholesterol lowering medicines to reduce the risk of heart disease. And the treatment for diabetes type 2 are: some doctor will give medicine like 1. Use oral antibiotic or ADO like metformin to reduce sugar production in the liver. 2. Glimepiride to stimulate the pancreas to produce more insulin. A few tests on health are regularly done by doctor, like HbA1c test, urine test, cholesterol level check, heart scan with EKG or cardiac stress test, liver, kidney, and thyroid function test. And don't forget, both of type diabetes always do physical exercise. Keep doing physical exercise while still paying attention to the condition of the body. Before I end this video, let's work together to maintain a healthy body and mind, also implement a healthy lifestyle to avoid diabetes, because diabetes is a deadliest disease that very dangerous for everyone, regardless of age and gender. Our body can help because our healthy life. So, an ounce of prevention is worth a pound of cure. That's all for me. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.